Yes, sir. Over to you.
Yeah. So, as a neurosurgeon, there are some insights I can share. Like you must have all been already aware about the general ergonomic pattern and everything. We'll be having general
Yes.
training. But my perspective will be something like as a neurosurgeon, what I've learned about spine, and I'll go somewhat in depth about it. So,
Yes.
that the entire brain and the skull carries a weight of around 6 kilogram weight. So the entire weight is supported by the spine, which carries the cervical, thoracic, and lumbar, and the sacrum and the coccygeal region. This carries the entire weight of the skull and the entire body. Uh, so over period of evolution, like we have all evolved from the four-legged animals and in the bipedal gait, which is a part of our uh, energy expenditure, or the entropy, to preserve the energy that the body or the has evolved into a bipedal gait over a period of time, because
Yes.
from four-legged to animals to this bipedal gait, there's a lot of surface area and the energy expenditure was high, and that over a period of time has led to a bipedal gait. That, but the side effect of that has generated a major kind of strain over the lumbar region, because of this shift in the from the four-legged animals to the bipedal gait. So that is a part of evolution, or the in some way it is advantageous, but for the spine it has become a disadvantage for the spine. So especially the spine has got an S-shaped curvature. If you see, the force vector from the entire skull falls onto the, there's a center of gravity where the weight of uh, the center of gravity of the uterus falls onto the just in front of the spine.
Yes.
Ideal condition. But if you are so what happens
Please,
uh,
please take your, yeah.
is, so like, kyphosing event, if you have seen old people, they are over a period of time they bend spine. If old ladies, they walk around spine also. This is like a normal natural event of this. But what has happened is uh, everything is built out of the spine built out of collagen, which has a genetic component, which we inherit from our parents. So in some cases, what happens is because of genetics, our body may be an inbuilt error in the collagen metabolism or something. So we are by itself not disc herniation. So
Yes.
there was an interesting study of that's called a twin spine study. Like like so about that, 20 to 30% of modifiable factors we kind of want to reduce this kind of degenerative. But whatever we try and do, there is a limit to what we achieve in that.
Yes. So yes, as you said, little, yeah, it is good that you have driven us right from little basic anatomy and try give us a lot of understanding that how spine is different. Yes. So going forward, yeah, we do have speakers in the panel, so they like to understand from your end. Yes, over to you, Aditi.
So I would like to know what actually a posture means. Like in our day-to-day life, the way we walk, the way we stand, or way we bend at our office, at our homes, does it actually matter about, maintaining a posture, does it really matter?
Yeah, so that's an interesting question. So so now right now when you're sitting in front of this computer also, there are so many factors which decides your posture. Whether if you have eyesight issue, so you tend to sit more forward.
Yes, sir.
So or sometimes over after a period of even if you try to sit more 5 minutes, then after a period you become kind of relaxed, and then you tend to the shoulders tend to stoop. So like the prolonged forward sitting, what it makes it that the strain over the lumbar and the cervical area
Yes.
like tends to become high because of this load sharing. Because I told, so there's a force vector from the head which carries a weight of around 6 to 6 kilogram that falls equally to all the disc areas. It is better. So the moment we stoop forward, it's an asymmetric proportion of weight which is transferred over to the load which is transferred over to the cervical and lumbar region. Because the rib cage, thoracic area is kind of protected, but most of the mobility happens in the cervical and lumbar region, which predispose to this disc herniations and
Yes.
degeneration, desiccation.
Yes.
Initially,
So we, yes. So we kind of a static pressure I think one experiences when
yeah.
Yes.
you don't move and
So if you are looking at the athletes and everything, they also bend forward and come back. But unlike that,
yes.
the office professionals, it's a static pressure, as you rightly said. That is the basic cause for this
Yes.
degeneration to accelerate.
Yeah. Over to you, Vijaya. What you wish to ask from Dr. Sayuj? Yes.
Yeah, from my side, um, one of my friends, sir, she's a pregnant woman. Routinely, she complaining about lower back pain, sir. Could you please give some suggestions, sir?
So, pregnancy is a totally different scenario where the ligaments stretch, uterine ligaments and other ligaments
Yes.
can also predispose to this kind of back pain. Just alone posture correction alone may not be sufficient in those conditions. So, in that also regular stretching and light exercise should kind of put resolve some of these issues. In some issues, we can adopt for
Yes.
cold or hot compression or methods, or physiotherapy. They can do ultrasound guided massage or something. That should actually give some symptomatic relief in those conditions, because especially you are not able to take any pain medicines at that period of time.
Yes,
Yes.
sir.
Yes. And how I would understand is most of the time backaches, low backaches, and this back stress problems are ignored, and the common people, they just take someone then so art what is the impact of this poor or incorrect posture on spine health? Yes, sir, over to you.
So, posture is the second reason. First is lack of exercise. Posture,
Yes.
if you say if you continue the same posture at least for 10-20 minutes, that is going to put a pressure, undue pressure over the spine and going to cause pressure. But more than that, so the spine is supported by this bony structure, the ligaments, the disc
Yes.
space. There is a core muscles around it, all the thoracolumbar muscles and the fascia and everything, which also supports, puts a lot of strength to the spine. So,
Yes.
over a period of time, if you tend to sit posture, this neck muscles behind become wasted, and then it sags over that, and then over a period of time, there's a tendency to for kyphosis to develop. There's for anybody, life is a kyphosing event of sense.
Yes.
So,
Yes.
ideal posture is to put your ear parallel to the shoulder and then sit, and then the computer which you are using should be at the eye level.
Yes.
So
Yes.
that is one main important factor when you, if you're in any using computer for your workspace
Desk
or
bound
any
job. Yes.
also.
Yes.
So and if you have a particular issue that you have to correct, because sometimes we tend to move forward because we cannot see the letters or something on the computer,
Yes.
and that is also a primary reason why people tend to stoop forward and the poor
Yes.
posture.
Yes. Very grateful insight. Yes. Over to you, Gargi from Tripura. Yes. Gargi, are you audible? Okay, maybe there's a technical issue. So again, going forward, which professions are most prone to have this posture related issues and how common is it? As you rightly said, desk-bound, corporate professionals, because you are the expertise, you may be, you receive a lot of patients who comes with this potential, problems in day-to-day life. Yes, over to you. So,
Yeah, so like the main most of the people I see are from IT professionals. Of course, I do see office professionals, nurses, and all coming with
yes,
back. So like one of the main thing
yes,
is like
yes,
so lumbar spine has a curvature, like a shape curvature. So when you are sitting, ideal to put a lumbar support, like so that the head goes back. It's all not always easy to be conscious and then sit forward. So if you're keeping a lumbar support, which you can purchase from some shop, like that will actually support the lower back, and then automatically the head tends to go back. Just putting the head back and then standing, sitting, it will not work all the time. We tend to be lazy, and then automatically the there is a tendency to stoop forward. But that is one aspect of sitting. Like sitting anyway is harmful
yes,
for the
yes,
body, like, for a period of time. So every time 20 minutes, get a break and then do sit-ups or something if you're working in office. And I think that's the only way, like in office professionally, we can get adjusted to it. Some kind of exercise we just have to
yes,
spend
yes, yes.
when you're working
We,
in office hours.
yes.
Yes, ma'am. One thing can I ask, ma'am?
Because we are not, yes, just a minute, Gargi. We are not very mindful and watchful about our posture and the way we, stretch ourselves. As rightly you said, after 20 minutes, it just stretch on and then come back to the same right alignment of posture. Yes. And yes, going forward, Aditi, yes, over to you.
Yes, sir. So can poor posture or body mechanics
Aditi, are you
lead
there?
yes, ma'am. Can poor posture or body mechanics lead to backache or spine stress, sir? Or else anything else would be experienced? Like, is it something always related to the way I work? Is it related to my backache, sir?
So
Because
posture is just an aspect of it. Like this posture, you can correct and then sit.
Can,
If you need to sit in
uh,
a straight,
yes, ma'am. I can ask something.
here the thing is, sir, if I talk about my
Yes,
OT
can I
nurses,
ask?
OT nurses, most of them are like they stand for a longer period of time.
Yes,
yeah.
ma'am.
Yes.
So like anything static, like anything that you are doing for a
Yes,
constant period,
Gargi.
to get the negative impact on the spine. Rather than the if you sit or stand straight or whatever the normal posture also, that is going to happen. You are not doing the stretching in between. If you are not taking break in between and doing the stretching exercises, because as I told, the core muscles
Yes,
carry a different support for the spine and the body weight.
Yes, sir.
So in order to do that, even if you sit continuously in the correct posture for 10 hours, 8 hours, that is also harmful actually. So only way is to get up and then do some sit-ups or exercises. That is only going to strengthen the core muscles and then add to the support. Otherwise, like just correcting the posture is not the only way to get a spine health, to avoid these issues.
Got it, sir.
yes, yes.
There's no alternative to exercises
Yes, as I think about this slide, you have already spoken.
yeah. So these are ideal.
Yes. Yeah,
So
Vijaya, and I think you have already given few tips.
yeah, so this is very common. Like we can, or in social media, everything we
Yes,
know the way to sit, and in while lifting weight, we should not bend on the spine. We have to bend on the knees. These all people are aware about these things, but there's we because exercises is something which we often ignore. Like there's no alternative to ideal exercises which we ideally should be doing. At least WHO also recommends around 30 minutes of exercises daily, and that aspect we should not forget. Posture is of course important. Posture comes second, but if
yes,
you exercise comes first.
yes. So these are the few glances of poor postures. I think, as you rightly said, one the
Yeah. So
exercise, the
in
posture
this
comes.
image,
Yes,
in this image, see this first image, this person is sitting like there's a gap there. So the lumbar
yeah,
support
yeah,
ideally will support in that area, and then that can put the head back.
yes, yeah. So yeah, so one more thing, yes, I think Aditi, you like to
Yes.
ask this too from Dr.
So,
Yes.
sir, is like can sciatica occur or contribute due to the poor body mechanics or spine issues? Like majority of the healthcare workers or the people who are sitting for a long or standing for a long, we see them getting this like pain, numbness, or tingling sensation. Is it something related to the posture, sir? Would like to know your insight on this.
Yeah, so sciatica, there are different causes. Like one can be a disc herniation. Sometimes it can, after coming, the sciatic nerve can get stretched between the piriformis muscles. That's called piriformis syndrome. So there are multiple reasons for this. Some are genetic because of the as I told earlier, the disc has got an annulus and the nucleus inside, and the annulus is made up of all collagen. So some of our genetics make up how good is that collagen or how good is that nucleus. So any degeneration is also genetically we are predisposed to have this back pain. But if you align the posture, if you do exercises, maybe we can correct up to 20%. We can avoid all these things. But of course, there is a non-modifiable factors behind it. But the other things like piriformis syndrome, the muscles and everything, those are correctable with the physiotherapy exercises and everything. But body also has a healing capacity. So if there's a disc herniation, the 2 weeks of exercise, physiotherapy and exercise, the body will automatically heal it also. And whatever is predisposing to that event, we'll have to be careful and then avoid that if it is a bad posture.
Totally said, sir. Thank you
So
so
yeah,
much.
yes. So yes, I think we can talk a whole lot of things about it, but yes, we are just going to as we said, we will be having only a timeout session, and we urge all the viewers to refer our website, which is www.yashodahospitals.com for more academic and current health updates. As this was a very vital topic, yes, and I like to thank Dr. Sayuch for your very valuable contribution, though you were engaged with your surgeries and daily activities of attending patients. And I like to thank all the speakers. And I apologize if it all because we were also experiencing the technicality glitch. Yes. Thank you. And thanks. So we end the session, Dr. Sayuj. Thank you.
Yeah, thank
Thank you, ma'am. Thank you for the opportunity.
Thank you, sir.
Thank you.